This study aimed to compare open versus robotic radical cystectomy with a totally intracorporeal urinary diversion. In particular, the aim was to assess 3-year outcomes including perioperative transfusion rates, complications, recovery, costs, and quality of life. To do this, they set up a single-center randomized control trial with 116 patients with muscle-invasive disease or high-grade non-muscle invasive disease suitable for radical cystectomy without contraindications to robotic surgery. These patients were then allocated to either open or robotic approach using covariate adaptive randomization. The primary outcome was a perioperative transfusion rate reduced by 50% in the robotic arm. With a 4-year follow-up, the authors found a significantly lower transfusion rate in the robotic compared to the open arm, with an absolute risk reduction of 19%. However, the operative time was significantly longer for the robotic approach, with an added time of approximately 2 hours. There were no significant differences in complications, both perioperative and postoperative, and there was no difference in readmission rates at 30, 90, and 180 days. Daytime continence at 1 year was approximately 50% for both groups, whereas nighttime continence recovery was 36% for the robotic and 58% for the open approach. However, it was not significant. Body image and quality of life was significantly better in the robotic group, with in particular the open approach scoring worse for both abdominal bloating and flatulence at 1 and 2 year follow-up. Costs were significantly higher for the robotic group compared to the open approach, with a mean difference of approximately €15,000. And finally, oncological outcomes showed no significant differences between the two approaches, with a cancer-specific survival approaching 80% in both. To conclude, robotic radical cystectomy with intracorporeal urinary diversion is a safe and effective option, reducing transfusion rates by 50% with comparable complication rates and oncological outcomes to the open approach. Robotic radical cystectomy seems to offer an advantage in body image perception and quality of life. However, this is offset by higher costs.